The other trial was originally developed by Ann Lean and myself when I was at Baylor, where we're expanding T cells from patients with Hodgkin's and non-Hodgkin's lymphoma. So this trial is highly innovative because it actually, in a single product, will target 5 tumor-associated antigens that we know are broadly expressed on Hodgkin's lymphoma and non-Hodgkin's lymphoma. So these are PRAME, SSX, Survivin, NY-ESO, and MBChB. So the idea for this approach is that by generating T cells in a single product that don't require gene manipulation, but that express multiple, that will recognize multiple tumor antigens, that you'll overcome one of the big hurdles that we have of tumor-induced immune escape, where, for example, what we're seeing in the CD19 CAR studies, that many patients that are relapsing with CD19 negative disease. So the idea of our strategy is that if your product is recognizing 5 different tumor antigens simultaneously, then the likelihood that the tumor cell would lose all 5 tumor-associated antigens is unlikely, and so you will reduce the chance of immune escape. We have now established safety with this approach in a dose escalation trial, and showed that we did not see any dose-limiting toxicity. And furthermore, in the subset of patients with Hodgkin's disease, over 50% of these patients who had pretty refractory, high-risk disease went into a complete remission. So this represents an exciting approach that doesn't require gene transfer, so has less of the regulatory concerns of, say, a chimeric antigen receptor trial, and then can be obviously used in a more broad platform to treat other cancers that express these tumor antigens, including solid tumors. I think where we can go to also with this approach is that there are a lot of what we like to call epigenetic modifiers, such as HDAC inhibitors and demethylating agents, that can be used in conjunction with this sort of therapeutic. We know that those sorts of agents will increase the expression of these tumor-associated antigens on the surface, and therefore allow our T cell therapy product to have enhanced killing of these tumor cells in the patients. Furthermore, with all the excitement, especially in Hodgkin's disease, of the checkpoint inhibitors, we can see a really novel therapy, combination therapy that could be used here, combining checkpoint inhibition with adoptive T cell transfer using these multi-tumor antigen-specific T cells, and could really provide a non-chemotherapeutic regimen for these patients.